Hello, my name is Chevon. I'm going to be your nurse practitioner today.
How are you?
I'm good. How are you?
Good.
So what brings you in today?
I just need an annual assessment.
Okay. So today we're going to focus on three main systems. I'm going to do a neurological assessment, also an abdominal assessment, and then a musculoskeletal assessment
Perfect.
as well. So can you tell me your full name and your date of birth?
Of course. First name is Sheen, last name Lipscomb, date of birth is 09/10/1991.
Perfect. Can you tell me what year it is?
2017.
And who's the president?
Donald Trump.
Alright, so I'm going to have you smile for me. Good. Can you clench your teeth? Good. I'm going to have you stick out your tongue and go side to side.
Okay.
Alright, perfect. So there's no tongue deviations. Can you scrunch your nose? Good. Raise your eyebrows. And I'm just going to check some visual acuity. So
Okay.
I want you to tell me when you first start to see my hand.
Okay. Okay.
Good.
Okay. Okay.
Here I'm assessing his peripheral vision. Then I'm going to check his 6 cardinal gazes and also conversion. So I'm going to have you just follow my finger with your eyes.
Okay. Good.
Perfect. So I'm just going to have you look at my nose, and here I'm going to be assessing his pupils. Good. Good. So he has perla. Then from there, I'm going to have you raise up both of your arms. Good. Close your eyes. There's no drip as he is holding up both of his arms. Can you feel me on both sides? Perfect. I'm going to put some pressure. Don't let me push your hands down.
Okay.
Good. And then turn your hands the other way. Good. Same thing. Don't let me push your hands down. Perfect. You can lower your arms. Then from there, I want you to tell me if I'm touching your left side, your right side, or both.
Okay. Left. Right. Both.
Good. And then can you hold your arms back up for me?
Yeah.
Good. I want you to squeeze both of my fingers. I'm testing for strength. It's a 5 out of 5, which is perfect. Then from there, I want you to raise your left leg for me. Good. Raise your right leg. Good. Then hold up both of your legs. I want you to push on the brake and the gas, and then flex up towards your nose. Good. Also, while I'm here, I'm checking the Babinski, which he has a positive Babinski, which is good. And then from there, same thing. I want you to indicate if I'm touching your left, your right, and or both. So
Okay.
close your eyes for me.
Left. Right. Both.
Perfect. Then from there, I'm just going to do a sensory test.
Okay.
So same thing. I want you to close your eyes,
Okay.
and I just want you to tell me if the pressure that I'm applying is either dull or sharp.
Okay. Dull. Sharp. Sharp.
Does it feel the same on both sides?
Yes. Sharp. Dull. Sharp. Dull. Sharp.
Good.
Sharp. Sharp.
Perfect. All right, you can open your eyes.
Okay.
Then from there, I'm just going to place 2 objects in your hands. Can
Okay.
you hold up your hands for me?
Yeah.
Perfect. And then just tell me what object I placed in your hand.
Coin.
Good.
Paperclip.
All right, perfect. You can open your eyes. As I have your hands on your legs, I just want you to rapidly move your hands on up. Perfect. Then I'm going to have you stand up for me.
Okay.
Here I'm just going to be assessing his gait and his balance, so I just want you just to walk across the room. Walk regular. Perfect. Then I want you to go toe to heel. Good. Then I want you to walk on your heels for me. Sorry.
You're fine.
Perfect. When you come back across, I want you to walk on your tippy toes. Good. And then I just want you to kind of march. Good. So you can have a seat.
Okay.
So his gait is steady. Last but not least, I want you to cover your right ear.
Okay.
And I'm just going to whisper something. Just repeat what I say.
Apple.
Good. Not very well.
Orange.
Perfect. So that concludes our neurological assessment. Next, we'll be moving on to abdominal.
Perfect. Thank you.
So now we're going to be moving on to the abdominal assessment. With this, since the patient is just here for an annual, there's not really any complaints that he's complaining of abdominally, but if he was, then we would go through old carts assessing like the location, duration, the severity. But I'm gonna start off with having you lie down.
Okay.
Throughout the exam, you want to make sure that your patient is properly exposed. So now I'm gonna reveal your stomach by pulling this up. During this time, you just want to inspect his abdomen for symmetry, which it is. You want to look to see if there's any masses or bulging. There is not. So then from there, you can ask the question about his bowel movements, and then you just want to take a general listen to his abdominal sounds. So you want to make sure that you're assessing all 4 quadrants. And then you also want to listen to the aortic area. And you're looking to hear if you hear a bruit, which would be indicative of a medical emergency. Then from there, you just want to assess his liver. Good, and then you would do the same for the spleen. From there, you also now want to you're going to find the liver tail. I'm going to have the patient, I'm doing the cupping technique. You can have the patient taking a deep breath. Good. And I'm feeling for the tail of that, and then the same for the spleen. Deep breath. Good. Then through there, I'm just going to do some light palpitation. And then we would go deep. And that's pretty much it. We would also assess his GU as well, but I'll be doing a critique later on in that for the video. Now we're moving on to the musculoskeletal assessment. Like I said, since this is just his annual assessment, he's not really coming in complaining with any type of pain. So we'll just start with our assessment. I'm going to begin with testing for TMJ. So I'm just going to place my hands here. I'm just going to have you open and close your mouth for me. Good. I don't feel any clicking. Can you grind your teeth side to side for me? Perfect. Then from here, I just want you to turn your head to the left. Good. Turn your head to the right. Any pain at all?
No.
Good. Then I want you to do your ear to your shoulder. So start with your left. Good. And then the other side. Perfect. From there, I want you to push your head forward. Good. And then flex your head back. Perfect. I'm going to have you stand up. And next I'm going to be testing for scoliosis. So I'm going to have you bend over and touch your toes. So during this time, I'm just looking at his spine. It's straight, it's a line, which is perfect. I'm also going to be looking for if there's any elevation on either side, which there is not. You can stand up straight for me. During this time too, I'm also assessing his hips. They're aligned as well. I will be looking to see if there's any elevation, like the left side is longer than the right, which it is not. You can go ahead and sit down for me. Next, I'm just going to be testing arm strength. So I'm going to have you just raise your arms out for me. Perfect. Then I'm going to have you hold your arms like this. I want you to push on my hands and then pull back. Perfect. So his arm strength is strong. Then from there, I'm going to have you kind of raise your arms to the side, raise them above your head. Perfect. And then I'm going to have you extend back. Perfect. Any pain at all as you're doing that? Good. From there, I'm going to have you raise your right leg. Good. Raise your left leg. Perfect. Then raise both of your legs up for me. Can you pull up towards your nose? Good. And then press on the brake and the gas. Good. Then I'm going to have you lie down. I just want you to raise your leg straight up. Perfect. And down. And then the other leg. Good. Then I'm going to have you extend your leg out here. Good. And then extend across this way. And then I want you to just extend straight out. One leg, sorry, one at a time. Good, back in, and then this leg towards me. Good. From there, you can sit back up, flip over. Then I want you to extend this leg straight up. Good, and this leg straight up. Perfect. You can sit back up for me. Then during this part, I'm going to be assessing his deep tendon reflexes. Before I do that, sorry, I'm just going to be testing his knee strength. So I want you to kind of just push up for me. Perfect. Since we don't have a hammer, I'm just going to pretend. So I'm going to be checking his brachial reflex. Good. Then I am checking here, and then also the tricep. Perfect. Here. And as I'm doing this, I should be lifting some type of movement, which it is. And then hold this leg up, and then I'm just going to be checking the Achilles. Good. So this concludes the musculoskeletal. So to conclude our physical examination, we're going to do the last part with me just speaking, just because this is more a sensitive area to examine someone. So I'll be going over a rectal exam and then also examining the male genitalia. So we'll start off with the rectal exam. So prior to any hands-on exam, you want to obtain a focused assessment. See if the patient is actually having any pain or any discharge that's coming. So you want to do a good history. So while you're preparing for the exam, you want to make sure that the patient is comfortable. And then throughout, you want to make sure that you're explaining to them exactly what you're going to be doing, because like I said, this can be uncomfortable for both the practitioner and the patient as well. So while you're preparing, you want to have them in a suitable position. So for the rectal exam, they can either be side laying and or standing leaning forward with the upper body resting and their hips flexed. So you want to drape the patient appropriately. Like I said, the main concern is making sure that they are comfortable throughout. And then also too, you want to have good visualization of both the perirectal and anal area, and gloves should also be worn throughout the examination. So like I said, you want to direct the patient, you want to explain to them step by step exactly what you're going to be doing. So you begin by inspecting the sacrococcygeal and perianal areas for any lumps, ulcers, inflammation, rashes, or excoriations. The adult perianal skin is more pigmented and somewhat coarser than that of the buttocks. You want to palpate any abnormal areas. You want to note any lumps or tenderness. And then you also want to make good notation of that, so any practitioner following you will be able to go to that specific area. Then you want to examine the anus and rectum. So you want to lubricate your gloved index finger and palpate the anal canal. So you're going to have the patient bear down and place the pad of your gloved index finger over the anus and the sphincter. Have them relax and then gently insert the fingertip to the anal canal. During this time, this may trigger the urge for the patient to move their bowels. You want to just reinforce to the patient that this is a normal feeling and they will not pass a bowel movement. During this time as well, if you do experience any tenderness or tightening up of the sphincter, you want to stop the examination and just have the patient relax before continuing on. So occasionally any severe tenderness prevents entry and internal examination. Never apply any force. And then instead place both hands on both sides of the anus and gently spread, and then you'll just do a physical exam versus actually inserting your index finger. But if you can proceed without any undue discomfort to the patient, you want to note the sphincter tone, any tenderness, induration, or irregularities or nodules. Sometimes sphincter tightness can occur with anxiety, inflammation, or scarring. You want to note if there's any lesions, and then consider testing the perianal sensation. Induration may be caused by inflammation, scarring, or malignancy. So then you want to move on, and then you want to palpate the rectal surface. So you're going to insert your finger into the rectum as far as possible with your lubricated finger. Then from there, you want to rotate your hand clockwise and then counterclockwise to palpate as much as possible of the rectal surface. You want to note again any irregular borders or suspicions for rectal cancer. Then with the male, you're going to palpate the prostate. by leaving your inserted index finger and rotating it further clockwise so that your finger can examine the posterior surface of the prostate gland. You want to make sure that you're explaining to the patient that when you're palpating the prostate, this might give them the urge to urinate, but they, again, will not. You want to note the size, shape, and mobility and consistency of the prostate, identifying any nodules or tenderness. So a normal prostate is rubbery, non-tender. Then as you're finishing up, you want to gently withdraw your finger and wipe the anus or have the patient wipe the anus. It's probably more comfortable to have the patient wipe themselves, but as you're looking at your gloved hand, you want to note the appearance of any fecal matter that's on the glove. So for the females, during this rectal exam, usually we're doing this when we're inspecting the female genitalia, but for this purpose, we're just doing a straight-on rectal exam, so it would be the same as the male examination that I previously just went over. So any abnormalities that you would note would be any external or internal hemorrhoids. You're going to look for like a prolapse of the rectum, any polyps or rectal shaft. During this, you can also possibly feel for cancers or any carcinomas. Then moving on to the male genitalia, same thing. This is a sensitive area for both patient and practitioner. So you just want to make sure that you're keeping the patient informed on exactly what it is you're going to be doing, and keeping them gowned and covered appropriately depending on what part of the examination you're on. So same thing, prior to the examination, you want to obtain a focused history, including any concerns or symptoms that the patient may be experiencing. So preparation, you want to have the gown patient either standing or laying supine. And if you're checking for varicelles, they must be standing. The gown should cover their chest and abdomen, exposing the genitalia and inguinal areas. And then you want to place the draw sheet at the mid-thigh, and gloves should be worn throughout this examination as well. So like I said, you want to always keep the patient informed, so explain step by step exactly what you're going to be doing to the patient. So you want to first begin by inspecting the penis, looking at the skin. You want to look at both the ventral and dorsal surfaces of the base, inspecting for any excoriations or inflammation. You also want to be examining their pubic hair. Is it equal distribution throughout? You want to be looking at the shaft of the patient, the penis as well. And if the patient is not circumcised, you're going to retract the foreskin, and looking for any irregularities. So with that, you're also going to inspect the glands, looking for any ulcers, scars, nodules, and or inflammation. You also want to look at the meatus, inspect the location, any ulcers, same thing, scars or inflammation, or ventral displacement of the meatus on the penis. You want to compress the gland gently and note any discharge. If the patient states that they've been having any discharge, but none is noted after this maneuver, you want to have the patient strip the shaft of the penis from the base to the gland, and if there is any discharge, note the color, and then you also want to be prepared to do a culture of that sample. Then you want to palpate the penis, so you would take your thumb and your first two fingers and palpate the shaft of the penis. Note any indurations or abnormalities or tenderness. If you retracted the foreskin during this process, you want to make sure that you replace it before proceeding to the scrotum. So now that we're inspecting the scrotum, you want to lift up the scrotum so that you can inspect the posterior surface, note any lesions and or scars, and then also, like I said, you still want to note any pubic hair distribution. Then you want to inspect for any swelling, lumps, veins, bulging masses, or any asymmetry. Poorly developed scrotum on one or both sides could suggest the crotochidism. And then you also want to look at the inguinal areas. Note any excoriation or visible abnormalities. You want to look for any cysts. Sometimes these are common. They're like whitish, yellowish polyps caused by occluded follicles. Then you want to palpate the testes. So between your thumb and your first two fingers, you are palpating them. You want to make sure that the testes are firm, but they're not hard. They're descending, symmetrical, non-tender, and they're without any masses. Any tender, painful scrotal swelling is present, and acute epididymitis, acute torsion of the spermatic cord, or strangulation of the inguinal hernia. From there then you're going to look for any hernias during the examination. So with this, the patient can be either standing or supine. You're going to check the inguinal areas for any bulges or asymmetry. You're going to palpate the groin area. So you're going to place the tip of your dominant index finger, and you're going to have the patient cough. During this time, you're going to be looking for any bulges or masses. And then you're going to continue on to the femoral canal and assessing for any femoral hernias as well. So this completes your assessment, and you also want to alert to the patient the importance of obtaining their own physical exam and educate them on the importance of doing a self-exam once a month.